Good evening, everyone, and welcome to ATP Live Monday. Whichever way or platform you're watching from, I really want to say thank you so much for joining us today. Um, Welcome, everyone. Welcome. And as you're joining us, feel free to drop your questions on whichever platform you're watching from, whether on our Facebook group or the Facebook page or the Instagram or YouTube channel. This is Ask the Pediatrician's Hour is a program where you can ask any question you have about the health of your children and get an answer live and direct over the next 1 hour. So let's try and maximize it. So you can start to drop your questions, and I will just use the opportunity to share the video link to all our various platforms to make sure everyone can see and everyone can hear. And while I'm doing that, I also want to use this opportunity to wish all our mothers happy Mother's Day. Yesterday was the first of the Mother's Days. Many of them we have in a year. So for those mothers in the UK, in all the countries where Mother's Days are celebrated, or Mothering Sunday, as some people call it, I want to wish you happy Mother's Day, and we want to thank you so much for all that you do for our children. We really, really appreciate you, because without our mothers, we know that we can't really, our children cannot survive. So you mothers are very amazing. You do a lot of amazing things, and we really want to say, on behalf of all the children, thank you so much. Happy Mother's Day, and our prayers is that you will live long to eat the fruits of your labor. So thank you so much, everyone. Um, so I'm trying to make sure I'm sharing the videos to all the various platforms. So please invite your friends too and let them join us. Also, today is our World Oral Health Day. This 20th of March. Every um, March, the 20th day of March every year is set aside to celebrate the World Oral Health Day. I would have loved one of our doctors, Dr. Bukela, to be here, but unfortunately, due to time differences, she can't be here now. But most likely for our Thursday session, she's going to handle that. So watch out for the session on oral health. I'm sure she's done several sessions for us before, so you can watch them. But the theme of this year is for you to be proud of your mouth, and obviously you got to take care of it as well. So I'll leave that to our dentist to teach us, hopefully maybe through our Thursday ATP hour. So those are the 2 days that we celebrated: Mother's Day and the World Oral Health Day today. All right. Thank you so much. And I hope those of you who normally follow us on Thursday, you listen to the my teaching on hearing and deafness last week. It's still available on our Facebook page, Facebook group, whichever way you want to watch it from. I think it's very important that we know more about hearing and deafness and the prevention and how to detect it. So I will encourage everyone to go and listen to that. So you're all welcome. Okay, I think I've shared all the videos, and I think I've pushed them to the various platforms so that everybody can see them and they can hear. And so let's start dropping the question. For those of you on Facebook, I can't see your comments. So drop your comments, whether you're watching on the video on our Facebook group or you're watching on the page on YouTube. Please let me see your comments. I can see those on Instagram already dropping all their comments. So welcome everyone. All right, there's so many questions on Instagram already. So I will start with that, and hopefully our Facebook people will catch up with us. Thank you. And just a little bit of housekeeping rule. When you are asking questions, please always start with the age of your child. Don't just say my baby, my baby. We need to know the age of the baby, because the age of the baby will help us to know um, how old your baby is, and whether we uh, um, that will affect the way we respond. You know, there are some conditions, even when you affect different age groups, the response will be different depending on the age of the child. So, and there are some things we cannot answer, like people asking about the weight and all that. If you don't tell us the age, it will be difficult to know what is appropriate or not, or development, for example. So please try and start with the age of the child. Try and go straight to the point. Things that require pictures like rashes and all that, you will be better off posting that on our group, because we need to see a picture. Unfortunately, you can't post a picture on this kind of platform, so you can only put your comments and all that. So try and keep it straightforward and straight to the point. So you're all welcome. Facebook people, let us know whether you have questions. The whole place is I can't see any comment from Facebook, so I hope you are there. So let me know you are there. All right, and I hope there's nothing going wrong on Facebook. All right, so let's just start with Instagram. Somebody said, can a breastfeeding mom ask a question? Yes, you can ask a question. If it has to do with breastfeeding, it has to do with something related to your care of your baby and all that. Yes, you can ask your question. If this is more about your own personal health issues, I'm not a physician, so I can do my best, whatever I know, but I guess you may still want to post that on our ATP family Facebook group, where you have the adult doctors, where they can really, so, but if it's something that has to do with breastfeeding, yeah, definitely you can ask. We can answer that. Or anything that has to do with you taking care of your baby, we can answer that. All right. So the first question I have here is from Miss BC. I guess it's Miss BC. Say hello. My 3-year-old has been coughing for about a week now. The cough is usually serious early in the morning and late at night. We have used cough syrup, but it's not helping. All right, so you have to take the child to the hospital. If a child is coughing and it is very serious, especially if it is early in the morning, late at night, it means there's something, triggering the cough. And maybe it's usually something that happens in the evening or at night. So the most common kind of situation in that case may be something that has to do with allergies. So like in asthma, those kind of situation. So you may want to take the child to see a pediatrician. They can ask more questions. They can listen to the chest of the child, and then they can advise on appropriate treatment. For example, maybe the child needs to be on some inhalers and all that. They'll be able to advise you. We don't recommend generally just loading children with cough syrup when they are coughing. Giving children cough syrup is like just giving paracetamol when somebody is having fever. You are not really treating them, you're only suppressing the symptom. And what is more important, especially for children, is not to suppress the symptom, but to treat the underlying cause of the illness. So, in fact, cough syrup generally is not something we recommend as such in children. So it's best to know why the child is coughing first and to dress. So sometimes cough could be due to pneumonia, could be due to asthma, it could be due to even heart problems. There are so many causes of cough, especially if the cough has been going on like this one now, a week. Okay, a week is not so long, but if it is going on for too long, then you would definitely need to know why the child is coughing, and that is what we need to address rather than just loading the child with cough syrup. So please see a doctor who can examine the child, listen to the chest, and then they can advise you appropriately. All right, the next person, Romsky. My 2-year-old baby boy suck his hand while touching his private parts whenever his pants goes off. Should I ignore? Will I outgrow it? Okay, so it is not unusual for children to explore their body as they're growing up. Some of those things are just habits, and what you need to do is to distract children from such habits. Since you already know that it is when his pants goes off, so when his pants goes off, do whatever you need to do. Maybe you want to clean him or whatever. Then let his pants goes back on again. You can also let him know that you don't, touch your private parts, on your own, or you do it only when you are, when other people are not there. You need to start teaching them the border parts. You need to start teaching them these parts are private, these parts are public, and you need to. For most children at that age, they don't even understand. What you need to do is to give them something to do with their hands. So also you mentioned sucking his hand and all that. You see that it's also sucking his hand normally, because this is another habit that you also need to deal with. So just focus on that. So usually for children, if you give them something else to do with their hands, like a toy to play with, so it's unlikely for them to be playing with the toy at the same time sucking their hands, at the same time exploring their body parts or genitals. So it's more of getting the attention of it and doing all the thing else. So that's what you really need to focus on and avoid those scenarios, and also use it as an opportunity to teach the child sexuality education. All right. The next question is from Miss BC. I think you're still asking about the cough. Okay, you are just telling us that you've been booked to see your GP. Okay, that's good. Since you've been booked to see your GP, then see the GP, and they can take it up from there. So um, there's nothing else you can do now. You just have to wait until you see the doctors, because you already been given a checkup syrup and all that, which is not helpful. So, which I don't even recommend. So there's nothing extra you're going to do. If you think it's really very serious, you can take the child to the emergency room. You don't have to wait for a GP. If you think the child is really, really coughing so seriously and you are really worried about it, then take the child to the emergency room. But if it is something that can wait, then you wait until you see the GP, and then they can tell you what to do. But more importantly, you can also take notes whether there are things that are like trigger, things that tend to, make the child to cough more. Maybe you may want to pay attention to the maybe smoke or perfumes or smells or things like that. Anything you notice that tends to cause triggers, and now avoid it. If you can't figure it out, don't no need to worry. You just have to wait until you see the doctors for further evaluation. All right. The next person, Miss Licia, say my 1 year old's not so bad while sleeping. Is there a remedy? Again, snoring is also a symptom, and it's sometimes it may be a symptom pointing to what we call obstruction along the airway. So most of the time, the obstruction will be due to things like enlarged adenoids or enlarged what we call enlarged tonsils, so anything that can block the airway, that could make children to snore. The good thing that sometimes as the children get older, some of these enlarged glands around the airway, they tend to shrink, and most of the time, the children will be fine. So we don't usually do much about it. But if the child is having symptoms like they're snoring and they're stopping to breathe, or they are having recurrent respiratory infections, they're having tonsillitis, they are needing antibiotics in and out of hospital, then those kind of children need to see a doctor, usually the ENT doctors, because sometimes they may have to do an x-ray to know whether the obstruction is really big and whether it's really complicated, like it's causing what we call obstructive sleep apnea, like the child is stopping to breathe or the child is having frequent infections. And then depending on how big it is, they may decide that we need to take it out. So sometimes they may need to do surgery like adenoid removal or tonsils removal and all that. But sometimes if it's not so bad, we just wait for it to shrink on its own. Most of my time, children about 5 to 6 years old, it would have become smaller and it's no longer an issue. So those are the things we need to do. So I'll recommend first to see your doctors. They can have a look, they can examine the baby, and then they can decide whether they need to refer the child to ENT doctors or whether they should just watch for now, and then that would determine what they would do next. All right. Official Dollar say I have tried severally to win my baby off, but which prove abortive. My major concern is I've not had any period. I've not had my period 1 year now. I'm still breastfeeding. How old is your baby? Always talk to us about the age of your child. It's so important for us to know the age of your child. There's nothing like you're trying to win a child and it's abortive. It means you are not emotionally ready to win the child. That is what it means. Because winning a child means you are just stopping breastfeeding and that's it. So if you are saying it's abortive, it means you start to stop and then maybe the child cries and then you put the child back to the breasts. And so it means you yourself, you are not emotionally ready to stop breastfeeding your baby, which there's nothing wrong with that. I don't know how old your baby is. If your baby is 1 year, we really encourage you to breastfeed your baby for as long as you want. You can breastfeed your baby up to 2 years. So there's really nothing wrong here. If you're not yet ready, just keep breastfeeding. Then when you're ready, you will be ready. You will know when you're ready and you can stop. So when you are breastfeeding, you don't have to see your period because breastfeeding itself is a form of contraceptive. It causes what we call lactation amenorrhea because some of the hormones that are released during breastfeeding and all that, you won't see your period, and there's nothing wrong with that. It's not a problem. It's not a disease. You don't have to worry about it. And I actually think it's a good thing because you're conserving your blood and all that. But some women, I don't know, like to see their period every time. So if you really want to be seeing your period, you can always see your gynecologist. They can give you drugs and all that. But really, nobody worries about a breastfeeding mother who is not seeing her period because we know that as long as you're breastfeeding, you may not see your period, and that is absolutely normal. There's nothing wrong with that. So, but when you're ready to win your baby, you can win your baby. So usually what we recommend is that you do it gradually. So you begin to reduce the breastfeeding. So if you are breastfeeding morning, afternoon, and night, you can decide that okay, I will breastfeed only in the night. Then so you make sure your child is already established on other food. Your baby is taking complementary feeds and all that. If your child is not taking complementary feeds, well, don't try to attempt winning. Don't attempt winning when the child is sick. That sometimes you don't do it. So for you to attempt winning, the child must be eating other food well. The child must be on full complementary feeds and all those things. So that's what you need to do. And on when you're ready, you just begin to reduce the period and the frequency of breastfeeding. So you can decide that okay, I only breastfeed at night, and then the time and the period you're really ready, then you just stop and you'll be ready. The child is going to cry, your breast is going to be full, you have to be ready to deal with that. It's going to take a couple of days. Some people may decide to take the children maybe to the grandparents for that weekend or something, but you must also be emotionally ready that I'm not, no matter how much the child cries, you're not going to stop. You're not going to go and breastfeed baby again. You wear your firm bra. We have a lot of tips on winning. If you go to our website, you can see some of those tips and you can apply them, and that'll be fine. All right. Okay. Your child will be 2 by me. So yeah, so you can stop breastfeeding when your child is 2, but I've told you what you need to do. It's just you being ready to do it yourself. But from the way you sounded, I'm not sure you are emotionally ready. You also have to be ready emotionally, like you're ready to let go. And if you are not ready, wait until both of you are ready and then you can stop. All right. Thank you so much. Okay, so I've not seen any question on Facebook, so I hope Facebook people you are there. I hope it's not that something is happening, which is very, very unusual. So if you still have any question, feel free to drop your question on the group so that we on either as comments on the internet, I mean on the Instagram, sorry, or you can drop it on our Facebook group directly, and for those who are on other groups like ATP Family, ATP Still a Mom, you have to click on the video so that you'll be able to drop your questions. So um, let's do that so that we can have enough time to answer your questions and all that. So I hope that our dentist will be coming hopefully during the week to talk to us about oral health issues as well. And just to remind us, while I'm still waiting for more questions to be dropped, that if you have any questions after the live session, you can always go to our Facebook group. We have about 4 of them where you can ask your questions. So if you have any question about your children's health, you can go to Ask the Pediatricians and you can ask your questions there. You can post your questions from Mondays to Saturdays. So most of our moderators and professionals, they'll be there to answer your question. You can't post on Sundays. We get a lot of people trying to post on Sundays and I can't post, I can't post. We've always said it and we've put it in our group rules, we put it in the welcome post, but people sometimes forget that. So please try and post between Mondays and Saturdays. And on for those who have adult health issues, you can post it on ATP Family Facebook group. That is where we handle question about pregnancy, all those adult health issues. You have to go to ATP Family. For first time mom, we have the FCM baby care group as well, and then we have the ATP Still a Mom group for those who have lost maybe pregnancy or children and they want some kind of emotional support and all that. You can post your question on HCP Still a Mom group. So those are the 4 groups that we have. And also you can go to our website anytime. Our website's www.askthepediatricians.com, and you can read about all these topics. You can read most of the topics where most people ask questions about breastfeeding, weaning, colds, cough, immunization. We have all these developmental milestones. We have several articles that you can read, and whatever you read on our website, you can take it to the bank because they are written by specialists, they are written by pediatricians and doctors, so you can learn from that. And you can actually ask your questions as well under the comments on those articles. It's not as fast as posting it on ATP Live or posting it on our groups, but our professionals do at least once a week. We go back to our website and clear off any questions that have been dropped. Okay, and then you can also listen to my podcasts on ATP Ask Dr. Baby ATP podcast. So there are lots of topics. So for those some who don't like reading, you like to listen. So I will encourage you to follow my podcast. It's available on Spotify, Ask Dr. Baby ATP. It's available on Google Podcasts, many of the podcast platforms, Amazon Music and all that. So you can listen. Most of the topics that people ask questions about, we've talked about them. And every Thursday, there's a new episode being dropped on the podcast. We call it ATP Hour. We also do that live also on our Facebook page and group and YouTube, as well as Fresh Waves Radio. So these are all the platforms, and you can always go back and listen to the past episodes. So you don't have to wait. So you can listen to past episodes and you can learn from them. So these are all the platforms that we have on ATP for you to learn. Of course, we also do community medical outreach, so you can watch out for us very soon in a community near you. And we're also trying now this because most of our professionals are now outside of the shores of the country. We're trying to do a lot more of tele-health and tele-video virtual assessment, and clinics instead of the usual outreaches, but we'll keep you updated about that. So thank you so much, everyone. Oh, I seen a comment from Facebook finally. So I'm sure that people on Facebook can see me and hear me now, but obviously they don't have any questions today. Thank you, Oni Bolano. Thank you so much for joining us today. I guess those on Facebook can always post a question on Facebook anyway, so they may have gotten their answers. For those on Instagram, some of you do send us your DMs and asking for answers to our questions. Unfortunately, we are unable to do a lot of answer to questions on DM the way it is structured, because most time we have our non-medical staff, handling the social media managers, so they cannot be answering your questions, and it's not something that you can click comments and approve when you're ready, like Facebook group. So it's best you post your questions on our Facebook group as much as possible, or you can post it through our website. But those are the ways where we can answer your question. We don't do a lot of emails anymore as well, because we find it's easier for you to put it on the group. And in the group, you can post your questions anonymously. So people don't have to know. I see a lot of people DM and say, or send me a Facebook inbox message and say, oh, I don't know how to ask my question. I don't want my mommy, my mother-in-law, or my friends, I don't want them to know, but I'm the one asking this question. I perfectly understand that, and that is why what we are one of those groups that pushed Facebook to introduce the anonymous option. So when you post anonymously, nobody sees your name. It's only us that will see it when we approve. Even after we've approved, we can't remember who posted the anonymous post anymore. So there's a lot of confidentiality, so you can post and nobody in your family will know. Of course, make sure you don't leave out, you don't put in any telltale signs that will let them know that you are the one. So, but you can post anonymously. So, thank you so much. All right, Facebook people are showing up gradually. Thank you so much for coming. Onyinye, good evening and happy Mother's Day. All right, I have a question on Instagram from Jodiac. Say good evening, please. When should teeth eruption begin? Okay. And when should a mom be worried? Okay, so this is a very good question, knowing that today is actually World Oral Health Day. So usually averagely, so most that when we answer this kind of questions, we always put the word averagely, because there's always a range. Okay, some people will do things fast, some people will do something late. It doesn't mean the fast or the late people are wrong. All those are still normal. But there's an average time majority of 50% of people will do it. So most children start to bring out their what we call the milk teeth as babies. So there are two sets of teeth in for everyone. We have what we call our milk teeth or the primary teeth. Those are the first set of teeth you bring out. After that, till the age of 2 years, then from age of 5 to 7 years, you lose all those teeth and you get them replaced by what we call the permanent teeth. So I'm assuming you are asking about a baby who is bringing out the first set of milk or primary teeth. So usually that should happen from between 5 to 7 months. So between 5 to 7 months, most babies begin to bring out the what we call central incisors, the lower one. Some may bring out the upper one, or some may even bring out both of them at the same time. It doesn't matter. So that is when babies start to bring out the first set of teeth. And by the time they're about 2 years to 2.5 years, everything, they should have at least 20 completed sets of teeth. So, but some children can be a little bit slower, and we don't worry until the children are at least 1 year, 13 months old. That is when that's like the maximum cutoff. So if your children have not brought out any teeth by the time they're about 1 year old, then you can see a dentist. Anyway, the dentist wants to see you when your baby is 1 year old anyway for the first dental appointment. So whether they've brought out out the teeth or not, I mean, a tooth or not, you can see the dentist when your children are 1 year old. But usually, some children may not bring out their teeth until they are 13 months, 1, 3 months old, and that is still normal. It's nothing to worry about. I don't think dentists worry because invariably all the children will still bring out their teeth unless they really have a medical issue, which is very, 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 very rare. So that is so from 5 to 7 months normally. But even if you don't see it until 1 year, don't worry. But try and see the dentist when your child is 1 year old for the first dental check. All right. Show me for King. Show me for King is always consistent coming on face on Instagram to answer a question. Okay, say can a breastfeeding mother take honey? Okay, so there's nothing wrong with a mother taking honey, a breastfeeding, and whether breastfeeding or not, you can take honey for yourself. But we don't want babies less than 1 year taking honey or getting exposed to honey because of the risk of a condition we call infant botulism. Infant botulism is a situation where um, there's a particular toxin, that can be present in the honey, which we as adults we can digest. Nothing will happen to us, but children cannot handle it. And so, if they get exposed to that spores or what we call botulinum spores, they can have a very fatal illness called botulism. So we don't want children to have botulism. So because of that, we don't want babies less than 1 year to be given honey at all. So if you are breastfeeding mom, I would just say you may want to avoid honey completely in your surrounding because you don't want a situation where your baby will be accidentally exposed to honey. But if you are very careful, taking the honey just for yourself and making sure your newborn, your infant baby less than 1 year does not get exposed to it, that is fine. But just to avoid any unnecessary error or mistake, then it's better that um, you don't give honey and you don't take it yourself. So that is it. But it is more for the children rather than the mother itself. All right. So then traveling for kids, how long should Infacol be given before a meal? Infacol is not necessary to give to your child. So Infacol is used only in babies who have colic, infantile colic. It's one of the remedies, and it doesn't really work for all the babies as well, but it can work. Some other shows works. It's more of a gas relieving, it make it easier for the baby to pass out the gas, and sometimes it's that passing out the gas that makes some babies very uncomfortable. So if you want to use it, you can just give it like a few minutes just before the meal. The description of how to use it is on the pack, so you can read it and follow the instruction. It's clearly always written on the pack, but it's not a fix it all when it comes to colic. Some children will still have the colic, and the colic will tend to go when it is ready to go. So that is how um, that's about colic. But usually you can give it shortly before the meal or even during the meal. It doesn't really matter. And you can be given with every meal as well. So, um, but the good news is that colic most of the time will resolve by itself when it is ready to go away. So you don't need to worry. All right. Okay, I think that's all the question I have right now. So if you still have your question, please ask a question. This is a busy Monday. All right. Okay, some people are just joining us. So if you're just joining us, welcome to ATP Live Monday. This is a program where you can ask any question you have about the health of your children, and you can get immediate answer from a pediatrician. So we've been answering a lot of questions on Instagram. For the first time, Facebook people don't seem to have questions. I know there are lots of issues with Facebook and visibility and all that. So I just hope people can see and they can join us, no problem. But if you don't get to ask your question now, no problem as well. You can always post your questions on our Facebook group from Mondays to Saturdays. We are there to support you and to answer your questions on your children's health issues as it may be. All right. So thank you so much for those of you who have joined us and those of you who have asked a question. So we hope you're satisfied. So we still have some time to take a few more questions before the program is over. All right. I think I have a question from Facebook. Onibola, no. Okay. Say my baby grew teeth at 3 months. What are likely conditions to be worried about? It's nothing to be worried about. Again, that's why when I was answering the last question, I qualified it and told you that there's an average, but some people will do it earlier, some people will do it later. So the fact that a child has done it earlier does not mean there's a problem. So just like I said, some babies may not do it until 1 year. Some children are born with their teeth. So we have newborns that are born with teeth. So, and it's not a problem. It's not a disease. So it is possible for a baby to even be born with their teeth or to even grow their teeth in the first 1 month of life, what we call neonatal teeth. So these are normal variation, and there's nothing to worry about. So your baby is bringing out their teeth at 3 months is nothing to worry about. It's just a normal range. So when we say this is the time children should do certain things, we are only talking about average 50% of people. Some people will still do it either earlier and it is still normal, and some people will still do it later and it's still normal. It's just that we have a wide range of what is normal. What this is only when it is really, really way off, So you don't need to worry. Oyinbola know about your baby bringing out the teeth at 3 months. That is still normal, and we're not going to worry about it. All right. Ada Winner is asking what causes heart defects in infant children. That's a very huge question, and maybe hopefully we'll get our pediatric cardiologist one of these days to come and talk to us about it. The truth of the matter, there are several things that can be associated or that can be the cause of a child having a heart problem or heart defect or hole in the heart, or what we call it congenital heart disease. So the heart of the baby is formed from around 3 weeks of life. Most mothers don't even know they are pregnant at this time when the baby's heart is being formed. The heart starts beating by 3 weeks. You have not mixed your period at all. You missed your period at 4 weeks. So as at the time your baby's heart is beating, you don't even know you're pregnant, because most mothers feel they're pregnant after they mix their first period, and that is already 4 weeks. So the heart is pretty formed early. If anything goes wrong during that process, it can lead to a hole in the heart. And there are many things that can cause that. Sometimes it's some genetic problems. Some children have some what we call chromosomal abnormalities or genetic abnormalities. So for children that have those kind of abnormalities, they can have holes in their hearts. So, like for example, a child with Down syndrome, they are prone to having a heart problem. Most of them needs to have heart surgery. Children with Turner syndrome, children with so many syndromes. Virtually most of the genetic abnormalities or chromosome abnormalities, they can cause holes in the heart. That's number one. Number two, if a mother is exposed to radiation, and that's why they always ask you if you are pregnant before doing x-rays, and they will only do it if it is like absolutely important and important for your life. Otherwise, if you are pregnant, you should not have x-rays. Exposure to radiations can lead to heart problems. Drugs, there are some drugs that can cause problems with the heart formation. And that is why you should not take drugs anyhow, especially if you're pregnant. And even when you're not pregnant, if you're likely going to get pregnant, you should avoid taking drugs. And some of us take all these so-called ABA medications and all that. Some of these drugs are so horrible and they can lead to holes in the heart. A lot of mothers do a lot of, especially in Nigeria, we abuse antibiotics a lot. Any little thing, I have fever, oh, I'm going to go treat myself for malaria and typhoid. Most of the time, you cannot have malaria and typhoid together. You don't have malaria and typhoid. It's either you have malaria or you have another infection. Most of you that are walking up and down and claiming you are having malaria typhoid, you're only deceiving yourself. When you have typhoid, you are very sick. You are on the bed. You are in the hospital. So most people just say, I have malaria typhoid, I have malaria because you've gone to do so-called wider tests. And then they tell you your wider is this, and you're walking up and down taking malaria typhoid treatment. It's just nonsense. And eventually some of you will discover that you're actually pregnant, and that's the symptom you're having. But because you are just using drugs anyhow, you've gone to take drugs, and yet you were pregnant. You didn't know you were even pregnant until you later missed your period and you've exposed yourself unnecessarily to antibiotics, to drugs. Some drugs should never be taken by pregnant women. So some of those things are the reason babies could have heart problems. Also, I'll talk about ABA drugs. I'll talk about genetic conditions. Sometimes we don't know. Sometimes it just happens. It just happened out of the blue. There's no explanation for it. So it's just one of those things that can happen. So there are sometimes we don't know why some children, it just something just went wrong when the heart is being formed and leads to that congenital heart disease. And it's just one of those things. So I hope those are the common ones that leads to congenital disease. And I think and also the most important thing is the ones you can avoid, at least avoid them. So avoid using drugs anyhow, especially if you're a woman, you are not on family planning, you are in a sexual relationship. It means you can get pregnant. It means you have to be very careful before you go and be using any drugs. Make sure you confirm that you are not pregnant. Avoid all these bad drugs. Avoid radiation, including all these mobile phones, sleeping with it, carrying it up and down very close to your body. You don't know how much of radiation they are causing to you. So those are the things you can avoid. But there are some things like genetic condition, and there's nothing you can do about it. So if it happens, it happens. I think what we really focus on in those instances is to diagnose it early and treat it early. Unfortunately, it's still so expensive to treat cardiac problems in Nigeria. We don't really have much. We're beginning to do some surgeries, but most people still have to be taken abroad, and they are pretty expensive. All right. Okay, somebody say there's a problem with Facebook as it is just blackouts on the board. Wow. And it doesn't allow you to see the names of questionnaires. Okay, I don't know what's the problem with Facebook. I suspect there's a problem with Facebook. What I'm going to do is to, because I was surprised Facebook people, nobody is asking questions and all that. So I knew there must be something wrong on Facebook. So what I'm going to do with our Facebook group is to share the link from the page to the Facebook group so that people can see it. Sorry about that for Facebook people. That's why I was asking whether Facebook people can see me, but I guess there's something wrong somewhere. Okay, no worries. Yeah, just let me know if you can see it now. Okay, somebody say thank you for the information. So if you're on Facebook, let me know if you can see it now. I can see Facebook user coming through. So I guess they are just seeing it now. I guess sorry about that. I think it's Facebook that caused all the problem. All right, somebody saying what causes autism, and it's every child that has speech delay autistic. Okay, let me start with number two. Every child with speech delay is not autistic. So there are children that just have speech delay and just speech delay only. Okay. And there are children that have autism that do not have speech delay at all. So there are people that have autism and they are talking perfectly well. So speech delay and autism is not necessarily the same thing. And however, most children with autism will have speech delay. Majority of them will do, but it's possible to have speech delay without autism, and it's possible to have autism without speech delay. So I hope let me quickly clarify that for you. So autism is a developmental condition where children have what we call difficulties with social interaction, social emotional reciprocity. They have difficulty interacting with people and responding to people, and in addition, they have what we call unusual behavior, repetitive and restrictive kind of behavior. So April is Autism Awareness Month. So April 2nd is Autism Day. So most likely, I think it's going to be falling around Easter period. If it's a Thursday or something, I would likely be doing. I think it's a Monday, so fine. So next on Monday, April 2nd. No, I think it's a Sunday, but the Monday after that, which may be April 3rd, I will do a full session on autism. So that will be a good day to tune in, and that will be in 2 weeks' time. It'll be a good day to tune in and listen to learn a lot more about autism. So we can talk a lot more. But if you want to read more before then, if you go to our Facebook page or group, there are lots of previous sessions on autism you can read. You can go to our website, read more about autism. You can go to Autism Speaks website, National Autistic Society. Virtually every country has their own autism society. Their websites are full of information. So please do not make a diagnosis of autism by yourself. You can only suspect that your child has autism. You need to see a developmental pediatrician to do an autism assessment. So we have to do the autism assessment and confirm, because there are criteria for autism diagnosis. So you cannot just say because a child is not talking or a child does not give eye contact, that means the child has autism. We need we need the child ticking a lot of boxes. So the child has to tick certain number of boxes on what we call the diagnostic criteria for autism for you to give the diagnosis of autism. So the child must tick all those boxes first before you can now give a diagnosis of autism. So you have to be careful, not just to label any child with autism. Yes, speech delay could be a symptom or a sign, but it's not the only thing. And there's no one single sign that only the child has this means the child has autism. No. So there are some signs in children on the autism that we also find in children who do not have autism. So the way we differentiate is autism has those symptoms or signs. The child who has autism is going to have several features in the two, what we call the social emotional reciprocity domain and the repetitive behavior. So there'll be issues with social interaction, making friends, responding to people, playing with people, doing things together. And then there also will be repetitive behavior, unusual behavior, rituals, sensory sensitivity. So there are several things that must be present together for us to make a diagnosis of autism. So, but like I said, if you come on Monday, in April, the first Monday in April, we'll talk a lot more about autism. Yeah, we have WhatsApp group, but we don't have a WhatsApp group for answering question and answer. So if you we have a lot of Facebook groups. So that is where you can ask your questions. So join our Facebook groups and you can join us there. We also have a Telegram group, but it's not for question and answer. So please, for you to, if you have question and answer for other, just go to our Facebook group, put your question and answer there. It's a huge group. We cannot maintain 700,000 people on WhatsApp. So on our Facebook group, we have over 700,000 people. So there's no way you can going to maintain that crowd on the WhatsApp. So WhatsApp is only for our volunteers and planning our outreaches, but for question and answer and all that, you have to go to our Facebook group. Yeah, right. Aria or Christiana is saying, good evening. My baby is 10 months old today with tooth teeth. Am I supposed to use toothpaste and toothbrush? Yes. Yes. Also, baby has bring out, even if it's one tooth, you should go and use toothpaste and toothbrush. And each of those toothbrushes are labeled according to years. So if you go to a good supermarket, you will see the age appropriate toothbrushes. So you go for the one that is age appropriate for your child. And you can use also age appropriate toothpaste. Usually sometimes they call them milk toothpaste. They must have fluoride, but the quantity of that fluoride is what varies. What the quantity for a child is different from that of adults. And because children don't tend to spit out their sputum, they tend to swallow it. So we don't want them taking swallowing too much of toothpaste. And some of them like to lick it. So that is why it's better to use a toothpaste for children, because the quantity of fluoride in that toothpaste has been regulated, let's put it that way. So we don't want the child to have too much of fluoride in the blood, because it can lead to a condition we call fluorosis, and it's not good as well. So we need the fluoride for strong teeth and all that, but we don't want too much of it, and that can cause additional problems. So you should use toothpaste and toothbrush once your child have teeth. So you stop using clothes and water. Clothes and water is before the child has any teeth. Once they have their first tooth, you're supposed to switch to the toothbrush and toothpaste. And if you watch some of our previous ATP Live on, especially the one handled by our dentist, she demonstrated to you how to do it. The quantity of the toothpaste is just a grain of rice. For children between 0 and 3 years, a grain of rice, if you just look at the picture of a grain of rice, that's the quantity of toothpaste that you should put on the toothbrush for babies less than 3 years. And for babies over 3 years, for children over 3 years, you should use a pea size or granules. You know how a granule look. That's the quantity of toothpaste. I know most of us watch all these toothpaste adverts, and they will put a huge amount of toothpaste from the beginning of the toothbrush to the end of the toothbrush, and even put a cuff at the end of it. That is not correct. That is wrong by the dentist recommendation. Dentists recommend that for children, use a grain of rice size of toothpaste. For children less than 3 years, and for children above 3 years, use a pea size quantity of toothpaste. And then they want you to do their brushing twice a day from morning and evening. You should do the morning one after breakfast and you should do the night one after dinner. I know most of us don't do it. We tend to brush our teeth before breakfast. Ideally, you should brush your teeth after breakfast and after dinner. So it should be the last thing, before you go to bed. So I hope that is helpful for the last person. I think there's another question on Instagram here. So T Silver says, should I be worried? My baby pools 3 times daily and it started since 3 days now, and the pool is not so watery. So the number of times the baby pool is not what worries us. It's the texture of the stool that we worry about. And always tell us the age of your baby. Okay, say your baby is 16 months plus. So your 16-month plus baby should not be passing watery stool. Your baby should be passing, what is normal stool, like sausage kind of shape and thick kind of stool, not necessarily hard. So it should not be watery at all. So whether your baby pass 2, 3, 4, 5 times, as long as they are normal stools, we are not going to worry about it. But if the stools are watery, because for you to be counting it, even though you are telling us it's not too watery, but I believe that you are counting that this too obviously is looking different from what you're used to, for you to be counting it that it's been going 3 times a day and it's now 3 days in a row. You have to make up your mind. Are the stools texture normal stools, or are they abnormal? Because that is the most important question. So there's nothing like it's not too watery. It's either watery or not watery. So you have to make up your mind about it. Because if it is watery, then that is diarrhea. If it is not watery, then that is normal. So if it is watery and that is diarrhea, then you have to give your baby ORS and oral zinc. How do you know a watery stool? A watery stool will take the shape of a container. So if your if your baby is in diaper, it will sink into the diaper like urine to go down the diaper, and you should see little or nothing at the top. Or if you put it in a potty, it will take the shape of the potty. That is a watery stool. So if it is neither of those, if it's not taking the shape of a container, it is not sinking into the diaper, then it is not watery. Okay. But if it is doing any of those, then it is watery. And then that is diarrhea. It really baby has passed it 3 times in a day. Watery stool, that is diarrhea. And that is when you need to give ORS and oral zinc. And you just keep giving the ORS and oral zinc until the diarrhea stops. For children, the most important thing when they're having diarrhea is not to stop the diarrhea, is to rehydrate them, is to replace the water and the salt or electrolytes or whatever they are losing. That is what you really need to do, replacing what they are losing from the stooling, from the diarrhea. So as long as you keep giving them ORS, the diarrhea will eventually stop by itself and the baby will be fine. What will kill a child is not the stool. It is the dehydration, it's the shock, it is the electrolyte loss. Those are the things that are dangerous. But if you keep giving the child ORS and oral zinc, you're replacing what the child is losing and the child will be fine. All right. So I hope that is helpful for T Silver. I hope you will stay here to listen to the answer to your question. All right. I think that's all the question I have today. Thank you so much, everyone. And it's really Facebook people that joined us so late. I guess you have some difficulties, but I'm happy you sorted. I can see you now. You can ask your questions. Thank you so much for joining us. If you still have any questions, please don't hesitate to go to Ask the Pediatricians Facebook group and you can ask your questions there. We are there Mondays to Saturdays. You can post your question and be patient. Usually we try to answer your question within 40 to 72 hours. Most time we do it in 24 hours, but sometimes some question need a specialist to answer it. So that is why it may take a little bit of time before we do that. So but usually within 72 hours we will answer your question. Of course, if you have any emergencies, please do not post on the Facebook group for our emergencies. Please to our go to the hospital. All right, go to the hospital. Emergency means something that is life threatening, something that if you don't do anything within an hour, we're talking about life going. So, or if it's something urgent, you need something done. Most of the time, there's nothing we can do about those on the Facebook. And as I'm talking to you now, I'm not on Facebook answering questions. So if you put an emergency question there, that's 1 hour wasted that could have been used in resuscitating and saving the child. So please do not post emergency questions. Any question that cannot wait, any question that you need an answer to straight away, is not to be posted on the Facebook group, is to be taken to the hospital. But if it's a question about general health issue, what should I do? How do I feed my baby? How do I handle this and all that? Things that can wait, yes, you are welcome to post that on our Facebook group from Mondays to Saturday. All right, somebody is just trying to post a question as I'm leaving. um, tissue collections. Gave birth to my twins at 35 weeks, baby. Blah, blah, blah. Okay, you want to know whether your baby's weight are okay. How old are your baby? 10 weeks old. Uh, baby one 4.3 and baby two 4.0. Okay, yeah, their weights are fine. They've gained weight. Your baby were 1.9 at birth and now it's weighing 4.3, and the one that was 2.2 is weighing 4.0, whatever. But the weight is fine, but you just keep breastfeeding them exclusively. Then Sherry say our baby of 1 year 10 months, she has been stooling, pool with mucus. I'll be giving her flagyl and zinc. If your child has diarrhea, do not give antibiotics, give ORS. ORS is the most important thing to give in a child who is having diarrhea, not antibiotics, not flagyl. Stop abusing antibiotics. Please use antibiotics only if a doctor prescribes. And the only time we use antibiotics with diarrhea is if there's blood in the stool. In other words, it is dysentery. That is the only time we use antibiotics. So I can't see you giving your child ORS and you're giving flagyl, you're giving zinc. No. For diarrhea, the most important thing to give is the ORS, not drugs at all. The zinc is even just to heal and to heal the intestinal wall. That is why we give the zinc. It is not like it's going to stop the diarrhea anyway, and antibiotics is completely not necessary. Give the ORS, okay? Most of you giving the children flagyl. Flagyl side effect is nausea, vomiting, poor appetite. The children don't even want to take ORS when you're giving them unnecessary antibiotics, and they become weaker. And these are the danger signs. This is when the child needs to go to the hospital. So please stop the flagyl and take the child, give the child ORS. If the child cannot drink ORS for any reason, the child is vomiting, the child cannot drink, that child has to go to the hospital. The child has to go to the hospital because we have to rehydrate the child through the veins, and that is the most important thing to do. Let's avoid all these antibiotic use unnecessarily. It's very dangerous. It's because we have so much access to antibiotics in Nigeria. You can just walk into any pharmacy and buy antibiotics. In other places, you will not be able to do that. You will have to get a prescription first from a doctor, and the doctor will not have prescribed flagyl for diarrhea. They would have prescribed ORS and oral zinc. All right, so I hope that is clear. Sherry Beauty Star. So just get ORS for your child, and if the child is vomiting, child not taking ORS, or the child is getting weak, the child is dehydrated or becoming, not responding properly, you have to take the child to the hospital. That is the most important thing to do. All right, great. I'm happy you got that information. All right, so thank you so much, everyone, for watching, and I will see you again next week. Have a wonderful and a beautiful day. Bye. And hopefully, our dentist will come next on Thursday to teach you more about oral hygiene. Bye.